Okay, so my name's Amy. I have been a heroin addict for 28 years, although I have been clean for 2 years now. I chose heroin as my drug because I'm a heroin addict. So the drug's name is heroin. It goes by street slang as smack, H, horse, junk, Chiva on the west coast, Montega on the east coast, and it is also known as diamorphone. The drug originated in 1810. Morphine was derived from opium in 1811. It was named after the Greek god of dreams, Morpheus. By the mid-1850s, morphine was more available in the U.S. and became popular with the medical professional during the Civil War. As a result of this, tens of thousands of soldiers on both sides became addicted to morphine. By 1874, a new wonder drug was invented in Germany. This drug was heroin. The American doctors thought that heroin was a safe and non-addictive substitute for morphine. The medical uses of heroin is pain management. It's used medically to treat heroin addicts for opioid addiction, and is also used for terminal and end-stage patients who may have cancer or AIDS or anything terminal. The cultural uses and norms of heroin is the drug has been popularized and glamorized by musicians and artists. They make it seem cool and it's the thing to do. The first people that used it were the Germans in World War II. It was a substitute for morphine, and it was more readily available for them over there. So they had a bigger supply of heroin than they did morphine, so they used it in the war instead of morphine. The purpose of the drug is made as a non-addictive alternative for morphine. How the drug has changed over time. It's been chemically altered to make it stronger. They have come up with cheaper ways to make it, including using cutting agents such as milk sugar, strychnine, coffee, shoe polish, and other adulterants. The adulterants don't diminish the potency, but they do cause severe damage in the user system, as you can imagine. The half-life of heroin is 1.3 minutes to 7.8 minutes, depending on the amount you've used. And the methods of use are intravenous, intramuscular, smoking, snorting, rectal administration, and you can also eat it. Physical characteristics of using heroin are pinpoint pupils, dry mouth, flushed skin, nodding off suddenly. Your breathing will be very slowed down, itching, nausea, vomiting, and constipation. The mental characteristics are unclear thinking, loss of memory, and poor decision making. The withdrawal symptoms are extremely horrendous, as I can attest to because I've had them many times. Watery eyes, excessive yawning, vomiting, diarrhea, muscle spasms, body aches, no appetite, and you cannot sleep no matter how hard you try. And this can last anywhere from a week to 2 weeks. Overdose symptoms. If the user has taken so much that it affects the respiratory system, then they can stop breathing and turn blue. Possible reasons for using heroin are trauma, depression, anxiety, peer pressure, pain management, self-medicating, and addiction. Treatment for heroin addicts is most commonly methadone clinics, inpatient detoxes, medical detoxes, counseling, rehabs, opioid replacement therapy. The health risks are HIV, hepatitis C, sepsis, death, gangrene, loss of limbs, abscesses, infections, including staph infection. Fertility risks. Heroin can cause spontaneous abortions. It can cause babies who are also addicted to heroin. And it can stop your menstrual cycle altogether. Now, these babies, when they are born addicted to heroin, they have to go through a medical detox themselves. So they have to be administered tiny doses of methadone, or else they can die because it's just too taxing on their body. Treatment methods are rehab, counseling, drug courts, which worked for me. The only thing that worked for me. Opioid replacement therapy, 12-step programs, and mandated UAs. I've been to 19 rehabs, 8 methadone clinics, and I can't tell you how many outpatient facilities I've been to over the past 28 years, but nothing has ever worked until I got admitted to drug court. So it was good. The success rate for a heroin addict is sadly very low. It's 2%. The recidivism rate are extremely high, even after treatment, which is also extremely sad. So I wanted to show you my picture here. This is an opium poppy, and what they do is they slice them, and the white stuff coming out is what they collect to make the opium, which they then turn into heroin. And they're beautiful flowers, but who knew they could cause so much devastation? And that is my presentation on heroin.